Guys, good afternoon. Let me introduce myself. Guys, I am Ponnu Pillai, physiotherapist, currently working as a senior physiotherapist in Abu Dhabi. I have more than 16 years of experience in physiotherapy field. Before I was in Chennai Apollo Hospital, and before 7 years, I moved to UAE. Today, the topic is iPhone syndrome. I think some of you guys maybe know about this condition and treated some patients like this. Personally, I treated 5 to 6 patients. The diagnosis. The first time I received the patient with iPhone syndrome, I was shocked. What is this? It's a new like that. Then I referred to the medical books and the Google and searching. Then I found this a new problem. Since so many years is arising and is spreading, same like Corona. Okay, so today we can see something points about, I want to make you people, to understand what is iPhone syndrome. Okay, let's go to the topic. Okay, iPhone syndrome. Okay, what is iPhone syndrome? It is a postural disorder of neck, upper back, shoulder, and hand. The problem occurs because of bad posture commonly adopted by people while using smartphones and handheld games. Okay. In the end of the seminar, I mean, the end of the presentation, I will tell you why it is named as iPhone syndrome. Why can't be the, there are many Android phones, Samsung, something, but why do specially made for iPhone syndrome? I will discuss later. Okay, we will discuss later. Before that, we will see that what is iPhone syndrome. What is iPhone syndrome? It is a postural disorder of neck, upper back, shoulder, and hand. The problem occurs because of bad posture commonly adopted by people while using smartphones and handheld games. Okay, some devices, using for the games also. Because of that also it will come. And etiology. What are the causes for this problem? Any orthopedic problem, when we study it, most of the orthopedic conditions we studied as cause is unknown. Like that only. This iPhone syndrome mostly, had us, it's a mechanical issue. Same as the mechanical back pain, some other conditions, orthopedic conditions we are studying. Same like that, this is a mechanical cause. For a long time, we are using the mobile phone, because of that it's coming. About 10 to 20% of people with problems caused by muscle overuse had smartphones. So we use smartphones, because of that this problem is arising. Okay. Symptoms. Okay, so any problem will have some symptoms. It's like an indicator. For the pain is a main indicator for our any problem we have, orthopedic, neurologic, or any problem, the pain is like an indicator. The symptoms of iPhone syndrome include pain and numbness in the neck, wrist, fingers, and thumbs, which, if ignored, could lead to muscle strain, recurring episodes of pain, and in the long term, irreversible damage, arthritis, and bone spurs, which require surgery. Actually, what is the problem in iPhone syndrome? If we use the smartphone continuously in the same position for a long time, okay, normally we know what will be the position of using the smartphones for a long time, using some games, some other things we are using in the smartphone. The position, very well, because each one is the evidence of this problem. Might be some, maybe here some of the participants will have this problem. But not aware of that. Sometimes the differential diagnosis is, commonly we referred as a neck pain, mechanical neck pain, upper back pain. Sometimes it is misdiagnosed. Okay. So exactly, mostly the iPhone syndrome is unilateral, sometimes bilateral. The logic is that, we are using mostly the right hand, sometimes the left hand. Some people are left-handed people will use it on the left hand. So the logic is usually on the unilateral, but sometimes it comes in the bilateral, because somebody using the mobile, sometimes right, sometimes left, like that. But it is uncommon. Mostly it is a unilateral problem. So initially it will start as the mechanical pain. So slowly, gradually wear and tear, it will lead to the secondary problems like arthritis and overuse of the, mainly in the hand, the thumb, the tendon of the thumb, the muscle will be, overused and getting the problem of the pain and the tightness and the severe spasm and the tendinitis, mostly lead to tendinitis on the fingers. So so many years, if you use like this, it will lead to surgery only. Okay, so before that, we should make awareness to the people. First, we have to make awareness on ourselves. Then we have to create awareness on patients, then the public. Okay, fine. Okay, so the clinical features, their heads are always bent and their shoulders hunched in a curve. This is a position, which position it is coming, I am mentioning. The heads are always bent and their shoulders hunched in a curve. This is bad posture, okay? In addition, they often hold the device in one hand and type with the thumb on the same hand. Okay, so what I told you before, people using the smartphone with one hand, always using the thumb to type something in the phone or play the game in the phone. Okay, so what will happen? One can type with the thumb on the same hand, which puts the thumb in an unnatural position, leading to muscle and tendon strain. As I mentioned before, the tendon on the thumb will get some strain. So wear and tear and the damage, everything will happen. How to prevent? Okay, my advice to anyone using a smartphone is to keep an upright posture and better to touch the screen with your fingers to avoid thumb strain. That means, in one hand we have to hold the phone and we have to use the fingers on other hand. Same time, we should avoid using the mobile phone continuously for a long time. Maximum, half an hour we can use and give some rest, like that, on and off. I know is more difficult because nowadays the smartphone replace the computer, because, I thought of doing this presentation on phone, my smartphone only, but, after that, I changed to computer. But anyway, most of my work personally, I am doing in my smartphone than the computer. The thing is that because it is, easy to carry out to outside, and mobile data will work on the phone, we no need the Wi-Fi connection. So many possibilities are there, more advantages are there in the smartphone. Okay, fine. So the prevention, the phone should be hold on one side and, we have to use the finger on other side, but it is difficult and uncomfortable. But even then, to avoid this problem, we have to advise the patients like that only. Okay. And, okay, then how it develops. Okay, how the iPhone syndrome is developed. Okay, the first thing people might find this that the muscle tear in their neck. The first symptom of the iPhone syndrome, people will feel some muscle, like muscle soreness or muscle tear in their neck and shoulders. Okay, if they don't correct this bad posture, they will start to have pain, which is in the long term could lead to degenerative arthritis. As I told you before, initially you start with some normal pain and the muscle, muscle tiredness, something, but progressively it will lead to arthritis. This is a very important point. And if you use two hands, it will lead to pain in one holding the phone as constant pressure is put on the wrist by pushing on the keys with the fingers of the other hand. If you use on the one hand and key in with the thumb on the same hand, it will also affect the thumb. As I mentioned before, the same point, if you use the mobile phone and one hand using the thumb will be affected. And if you use two hands also, it's a problem. Okay, if you use for a long time, that's what I told you. Don't use the smartphone for long time. Give some break. That's it. Now come to the treatment. treatment, I didn't mention anything because, I will tell you. The conservative treatment or surgical, any orthopedic problem, the two types of treatment, conservative and the surgical. Surgical treatment is nothing but, is very rare. For example, for the thumb, the tendinitis is coming, no? So tendon, for the tendon in the muscles of the thumb, they will do some surgical procedures, not on the neck and shoulder, only for the thumb. But it is very, very rare procedure. The main treatment is a conservative. The conservative includes without surgery, medications and the rehabilitation. Medication, what is that? Painkiller, and anti-inflammatory, according to the symptom we can give. But the main thing is the physiotherapy treatment. Physiotherapy treatment, why I didn't mention here, different types of practice in physiotherapy nowadays. Okay, some of them following the manual therapy, some of the electrotherapy, some of them, only by exercises. So, some kind of treatment. So many varieties of physiotherapy nowadays, and dry needling. Something different. But we cannot say, this treatment is better than that one because, in my experience, lots of patients I see, some patients, some condition treated nicely by the dry needling, some treatment, some conditions by the manual therapy, some of them by the exercises and other kind of electrical modalities. So in this case, you understood the symptoms. What is iPhone syndrome? So it's not a genetical disorder. It's not an infection. It's not nothing. It's only mechanical. So mechanical means, now I will show you the different slides at what is exactly the symptom of the iPhone syndrome. Okay, so the treatment is your choice. Okay, you can normally for the tightness of muscle, tightness of muscle will be there to reduce the tightness. What are the modalities you will use? You can follow that. Whatever the manual therapy is, you can assess, what are the associated problems. Any joint tightness, something is there, you can use the manual therapy to improve the joint range of motion. To reduce the muscle tightness, you can use the electrotherapy, a muscle release, muscle energy technique, myofascial release. Okay, mainly that what is the position of the iPhone syndrome patients. So you have to correct the posture. Okay, that's it. That's the physiotherapy treatment. You people know very well about the physiotherapy treatment. That's what I didn't mention more. Okay, now I will share another slide. Okay, yeah. What are the ways we can, avoid this problem? iPhone's a mechanical problem. What are the ways? Some modification, lifestyle modification. This one we can follow, and we can tell the patient to follow. First one, buy the good Bluetooth earpiece used for all calls. Yeah, normally, using the mobile phone frequently, we are using, attending the call, and all, sometimes we are hearing the, some nice songs also sometimes. Okay, so that time we can use the earpiece. What is the purpose of this? Our posture will be straight. Okay, and yes, same like the texting, emailing, everything. So no need to hunch over. Okay, we can use the earpiece and we can be straight. Then keep phone at shoulder level, arms bent, pinning elbows against ribs when texting and emailing. Normally we will keep the phone in the lower level so that we can we have to bend to see the phone. In this position, we can keep the phone in the shoulder level. Shoulder level. This also not for long time. Otherwise, again the shoulder pain will come. So our posture should be straight. Keep the phone in the straight level so that our body will be straight. Besides cranking, motivating playlist, no phone usage during cardio. Most of the people we see, during their cardio exercise, something they use the phone. This is not a good habit. Actually, whatever the work we do, we should focus on that. For example, some exercise also, some exercise is very, very important, because, many of the patients came to me, they went to gym, had a strain and came to, mostly you people also treated many people, the gym people. Okay, so that means, they didn't concentrate well on the exercises. Sometimes they might have put more weights. Sometimes, because of lack of concentration on the exercises. These are the things. So guys, as I told you before, the first one, go with the good Bluetooth earpiece. The second one, how to maintain the phone in the shoulder level like that. And third one, concentrate on the during exercises and all, you should focus on the exercises. And the last one, the perform a basic stretching routine below at least 2 times a day. Okay, so tell the patient to do the stretching so that the tightness will be prevented. So this is specifically what are the symptoms in the iPhone syndrome. According to our point, the muscle. What are the muscles? Secondary assessment. What are the muscles go for the tightness and all. And normally, very well that trapezius is a first muscle to become the tight. During this problem on the dominant side. Okay, you're for example, if you use on the right-handed, mostly the right-handed people, if you use phone on the right side, you will get the tightness on the trapezius on the right side. Second one, the tightness of the latissimus dorsi muscle. So dominant side, same side, and the tightness of the spinal erectors, and slight head tilt to the dominant side. Normally we use a phone like this, so the head will be, the mild tilting over the dominant side. Then tight triceps on the dominant side. Okay, and overlay the tight hip flexor. This one, depending on the sitting position. If we sit and using the phone for a long time, we will get the hip flexor tightness. And the rounded shoulders. Rounded shoulders automatically it will come. And slightly stoop posture, particularly in the upper thoracic and cervical spine. The cervical and the upper thoracic both are like brothers. Whatever the problem coming in the, especially the lower cervical, it will associate it with the upper thoracic. So we have to focus in manual therapy and some normal treatment. We have to focus on the cervicothoracic junction. That is the main thing to be mobilized. Okay, so this is the thing. Okay, now which screen you are seeing, Dr. Dumble?
Yours, Pillai's physio.
Okay. So guys, yeah, in this topic, I finished the topic of iPhone syndrome. You can ask the questions little later. Before that, I want to introduce my channel, YouTube channel. This is mainly I made for the patients. Okay, patient purpose, because most of the patients are not doing any exercise. They forget the exercise, the home exercise at home. For them, I created this channel because being in Abu Dhabi, I made these videos with some Arabic subtitle. If possible, you guys can support me. Also, you guys can subscribe my channel also, Pillai's Physio. Okay, so the first one you are seeing this video, I got some appreciation from the Sheikh in the Abu Dhabi. I treated him. He had severe low back pain. Went to many hospitals. Finally came to me. I treated him with the manual therapy techniques. He proved well, and he gave me some appreciation video. Something it is there, and here you can see. Oh, are you able to see the pictures of the video, right? So all the videos I put here. Okay. So in future, I plan to make a presentation for the what are the opportunities in the abroad, for the physiotherapy, because most of you people in India now, maybe you are trying for abroad and all, I want to help them to get to abroad. Okay, so later I will put that. Okay, fine. Okay, thank you. So now I am going to finish.
Thank you, Dr. Pillai. We have few questions.
Yeah. Yes.
It would be great if you answer those questions.
Yeah, fine.
First question is, any specific test to rule out this and also differential diagnosis for it?
Yes,
Is
yes.
there any specific test to
And
diagnose?
till now, because he say, being a new problem, till now, no special test for this problem, only according to the physical symptoms, we can combine with the test and the difference diagnosis. Normally people they're coming to us for the neck pain, upper back pain, mainly the pain in the trapezius and upper back scapular pain, right? So, there is no specific test, but with the symptoms, the tightness of the posture and the tightness of the trapezius and the latissimus dorsi, like that only we have to identify. Mostly it should be unilateral. Okay, for example, if it's a bilateral problem, it must be the upper back pain something. Difference between the upper back pain and the iPhone symptom. The main symptom is a unilateral actually, and according to the physical symptoms, the pain radiating to the hand. Sometimes we have to correlate with the the cervical spondylosis with the radiculopathy. Mostly, in my experience, I saw some 6 to 7 patients. The main symptoms are the tightness of the muscle in one side, mostly on the dominant side, and some pain radiation to the hand, not numbness, no numbness. Okay, no people for theory it is mentioned numbness, but numbness mostly to the cervical spondylosis, the radiculopathy. But in iPhone syndrome, there is no numbness, only the muscle pain, unilateral.
Okay. One more question is there.
Yeah, no problem.
Can iPhone syndrome can further complicate snuff box syndrome?
Stuff box. No, till now no evidence for that, but it leads to arthritis. Some tendinitis and arthritis. It's a secondary complication. But this one, no. Till now, no. In my knowledge, is no. Maybe we can search.
Okay. But continuous use of thumb can lead to carpal tunnel syndrome also.
Yeah, carpal tunnel syndrome possibilities are there because carpal tunnel syndrome. Yeah, some possibilities. A patient will feel some pain in the wrist. Either carpal tunnel syndrome or tenosynovitis. It may lead to that. Maybe, may not be. All the orthopedic problem. Now as a manual therapist, how we are seeing the patient. We are like our trainer, Mr. Deepak told us, when we had the train, and we are like a biomechanical engineer. Okay, so we are not seeing the condition separately. Okay, so we are seeing the body. What is the alignment problem? What is the problem? So same like that, iPhone syndrome. If you have the syndrome for a long time, automatically the biomechanics will be changing the body, right? So associated problems will come. So not directly from the iPhone syndrome, because of some postural changes, some problems may arise.
Thank you so much. Participants, do you have any more questions? One more question, sir, please. Any ergonomic aids that could be used
to
prevent
you mean
this syndrome?
some postural awareness will be enough, I think so. How to hold the phone, for we have to take some rest in between, like that. Simple methods enough. No need to wear anything.
And avoid, yes, right.
Some
Avoid
braces
long
are there.
uses of phone.
Yeah. Because for the upper back pain, we have some braces, right? So thoraco lumbar brace and all, no need, because this problem mostly coming for the age group, 20, 30, like that only, adolescents and the early adult, not for the old age people. So no need to think about any devices or supports. Okay, only by the postural awareness, will be enough, and strengthening the muscles, stretching and strengthening the muscles.
Right. Okay, one more last question.
Okay.
Why iPhone syndrome and not Android syndrome or the smartphone syndrome?
Yeah. Thanks for asking this, because I forget this. Yeah, in the presentation I told you lastly. Okay, I will explain. That I was also shocked why it is only iPhone, because lots of Android, why not Samsung syndrome, like that. Okay, then I found the answer, but this answer, after so much of difficulties, I found. Okay, so what is that? Normally, because iPhone is not a very oldest phone. Before iPhone, many the phone came. So why specifically they mention iPhone? The two reasons. Okay, number one is iPhone is very famous, and people made like that. A second thing, importantly, in normal other phones, normal other comparing to other brand, the iPhone is fastest one and no hanging. Mainly, the people will play the games on the iPhone because of no hanging on the phone. The people will continue the game for 2 hours, 3 hours, 4 hours. Same time, if you play the game in other phones, what will happen? Some network issue, and then a hanging problem will come. They will get bored and they will leave. So this iPhone, what is the problem? The service is very fast, no hanging, nothing. So people start using the phone for 3 hours, 4 hours, 5 hours. Some people are whole day. So definitely this will make a problem. So specifically, so they mention iPhone. So this is iPhone syndrome, and to make this condition to become famous, they made like that. But I don't know, maybe from the Apple company, they will ask for the justice for this. I don't know.
Okay, thank you so much.
Okay.
Okay, I hope all the participants enjoyed the lecture, and it's really informative because we have heard about the Android syndrome and didn't know about the iPhone syndrome. Why? The reason. So you explained very nicely. Thank you, Dr. Pillai.
Thank you very much for giving
Hope.
me this opportunity. Okay, so hereafter I want to present the more. I want to help our students. So the staffs, for the abroad, how to get the job in abroad and all. I will make the separate presentation for if you people like.
Yes, sure, sure. We'll organize one webinar again
Yeah.
for this, and hope the participants will be interested in such kinds of webinar also. So that would be helpful.
Okay.
Okay, so that's all. We finished with our webinar. Thank
Yeah.
you so much. Okay, have a good day.
Okay. Thank you very much, guys. Bye bye.